How does FNAC diagnose lymph node TB? Have you ever wondered how doctors diagnose lymph node tuberculosis? One of the key methods used is called Fine Needle Aspiration Cytology, or FNAC. This technique is quite fascinating and plays a crucial role in identifying this specific form of tuberculosis. Let's break down how FNAC works in diagnosing lymph node TB. First, the process begins with sample collection. A thin needle is carefully inserted into the enlarged lymph node. The goal here is to extract some cellular material. FNAC is considered a minimally invasive procedure, meaning it doesn't require major surgery. However, because it is a blind procedure, there is a chance the needle might not reach the exact area of infection. If that happens, doctors may recommend repeating the aspiration if there is still a strong suspicion of tuberculosis. Once the sample is collected, the next step is cytological examination. The aspirated material is examined under a microscope for specific features that indicate tuberculosis. One of the key signs is the presence of epithelioid cell granulomas. These are clusters of immune cells that form in response to the TB infection. Another important finding is caseous necrosis, which is tissue death that looks cheese-like and is highly suggestive of TB. Additionally, the presence of acid-fast bacilli, the bacteria responsible for tuberculosis, can be assessed using special staining techniques. To enhance the accuracy of the diagnosis, special stains and tests are often used. The Ziehl-Neelsen stain is one such method that helps detect acid-fast bacilli in the sample. This can confirm the presence of Mycobacterium tuberculosis. Another advanced test is the GeneXpert test, which detects TB DNA and can also check for resistance to rifampicin, a common TB treatment. When FNAC is combined with these additional tests, it significantly improves the chances of accurately diagnosing lymph node TB, detecting up to 85% of cases in areas where TB is common. Interpreting the results is the next critical step. If granulomas with caseous necrosis are identified, it strongly supports a diagnosis of lymph node TB. Furthermore, if acid-fast bacilli or TB DNA is detected, it confirms an active infection. However, if the initial FNAC results are negative, doctors may need to repeat the procedure or conduct further tests due to the possibility of sampling errors. In summary, FNAC is a valuable tool for diagnosing lymph node tuberculosis. It provides insight into cellular changes and can detect the tuberculosis bacteria in lymph node tissue. This outpatient procedure is effective and can often reduce the need for more invasive biopsies. However, its accuracy is greatly enhanced when used alongside bacteriological tests and molecular assays. If initial samples are inadequate, repeat aspiration may be necessary, especially when there is a high clinical suspicion of TB. Always consult with healthcare professionals for personalized medical advice and to understand the best approach for diagnosis and treatment.